Hello and welcome to COVID Conversations here on WNCU 90.7 FM. And we're using the Zoom platform to talk about COVID-19 and how it is affecting our world. So many normal campus operations have been upended because of the coronavirus, and colleges and universities have struggled to educate students and keep everyone, faculty, staff, and students safe, all while trying to keep the doors open. I have as my guest today, Dr. Kristin Long-Witter. She is the Director of Environmental Health and Safety at North Carolina Central University. Dr. Long-Witter, welcome.
Good morning and thank you. We're always very happy to talk about our success this semester, so thanks for having us.
Oh, you're certainly welcome. And I know you've had your hands full during this, and for you to talk about the agencies that have taken the lead during this pandemic on campus.
Mm-hmm. So very early on, our chancellor, Dr. Johnson-Akinleye, stood up our emergency response team. And as a part of that, we stood up the pandemic emergency response team. So that's really the group on campus, the leadership group that makes suggestions and follows the guidelines and comes up with these directives. And then those are actually carried out by two distinct groups on campus. So student affairs takes over every aspect of managing student COVID cases on campus. Then my group, Environmental Health and Safety, along with a fantastic group of new nurse practitioners in the nursing school who have stood up and just really jumped in and helped out. We take care of all of the faculty, staff, COVID issues. So those two groups, we try to remain separate just because the workload is so onerous, but at the same time, we speak every day and we're in constant communication.
Mm-hmm. I'd like to know also, what are some of the safety measures used to keep students, faculty, and staff safe?
So before we brought anyone back to campus for this fall semester, we made sure that we had plenty of PPE or personal protective equipment, so gloves, face coverings. We made sure we had plenty of personal cleaning supplies, so hand sanitizer, disinfectant spray, disinfectant wipes. So we have a full stockpile of that that the staff and faculty can order on our online system. We have signage and directional arrows and things like that to make sure that we keep our traffic moving in the right direction, making sure that we have students not sitting close enough together. We either reconfigured classrooms or marked seats, sit here, don't sit here. And then just really working, academic affairs worked very hard to make sure that we didn't have all on in-person, classes, and that we were able to offer a variety of class types to keep faculty and the students feeling safe. So I think those were the really big ones.
Can you tell me how many cases of COVID-19 have been reported on campus?
So I can give you rough numbers and these are cumulative figures since July 1st. So we have, if you look at faculty and staff together, we have about 18. We've had about 18 cases reported since July 1st. And we also look at our contractors. So people who are working on campus but don't work for NCCU, we've had 5 of those. And then we have roughly, I think at the last count, we had about 80 students that had tested positive.
So when you find that there are confirmed cases, like of students, around faculty and staff, what's the next step? Where do you go from there?
So again, we kind of break it down into the two groups. So faculty and staff obviously are sent home if they are on campus. We do offer occupational exposure testing. So if a faculty or staff member feels that they've been exposed on campus or they're identified through contact tracing, we will test them, we will quarantine them, and then bring them back to test on campus using CDC guidelines. Our students, and this is where I just cannot say enough about student affairs. I mean, they are truly parents. They have not slept. They are up 24/7. But we immediately, if that is a residential student, they're immediately moved into our isolation and quarantine space, where then they are managed and cared for in those spaces. We then identify contact of those students and quarantine those as well and provide that testing. And then we do have a reporting system. So we have a dashboard, a forward-facing dashboard on the NCCU website that reports out our number of students, faculty, staff, and contractors in a cumulative fashion. So everyone can go to that and look up those numbers and see what they are. If we have a COVID faculty or staff member in a building, our pandemic team is alerted, and then we work with our building environmental services group, who will go in and do a disinfection of that space based on the CDC guidelines. So it's actually something that unfortunately we've practiced multiple times, but it works very well for us.
Can you give me maybe a brief understanding about contact tracing? I saw it like in an example where there was a bubble before.
Sure. So we contracted with a company called Apex Solutions because we don't have, a large student health or occupational health service on campus. So we contracted with them. They provide all of our testing and contact tracing. So what they really do is once we identify a positive student or we're notified about a positive employee, they take on the contact tracing. So they reach out to that student or faculty member. They ask about all their close contacts. They ask about where they've been, what they've done. And from that information, then they pull anyone that they believe has had 15 minutes or more. This is where it gets complicated, within a 24-hour time period, within 6 feet of that person. They always err on the side of caution, and then those people are put into quarantine, which quarantine is for people who are, we're worried that they may get sick. Isolation is the definition of someone who is sick being isolated from the group. So that's kind of how that works. We identify all those, we err on the side of caution. And with all of this, I think it's really important to say that we follow the CDC and the Department of Health and Human Services guidelines, because those are really, that's where we get all of our information from.
What about COVID-19 rules on campus? How are they enforced? If you have people who just say, well, I'm not going to any of this.
So, nobody likes to talk about this, but it's been a reality. We've had to deal with this. So the students early on, all those residential students signed a contract, the code of conduct contract that they signed, but now it included COVID measures as that they must comply with as part of their contract. So violations of that for students have been handled by the Student Conduct Office, and I can tell you, we've sent students home. We have asked them to leave campus for non-compliance with these measures. The chancellor drew a very hard line and said that we were going to expect the same from our faculty and staff. So faculty and staff know that if they choose to not comply with the COVID measures on campus, that it is subject to disciplinary action up to termination.
That's very unfortunate.
It's very unfortunate, but we can't commit to keeping everybody safe if we have these people who choose not to. So we've had to draw a really hard line.
Tell me about the semester. So how has the semester gone? I know that there were over 2,000 students on campus. Overall, like what was with the mood with students when you talk to them about how important following the rules were?
So we had very early buy-in from our student government representatives, and they did our student leadership did a fantastic job of coming out very early on some of our town halls and saying, this is what we're going to do. Our students, I say we're like a family, and our students are like siblings. So, they will tell on each other. They will, we have a lot of that where, we get information from students about students not following the rules. In general, it's gone very well. So, everybody having to send students home after spring break was such a difficult thing to do last year. And the students didn't like it. We didn't like it. So being able to bring them back this fall was huge. But we needed everyone to understand that this came with a price. We have to have this compliance or it isn't going to work out. So we did that. We drew the hard line about, making sure that we were going to have some teeth and be able to deal with students and faculty that didn't comply. And I think that worked out. Once the word got around that this was no joke and that there were some really real ramifications, our students have stepped up, just fantastically. And everyone's getting tired. Everyone has COVID fatigue. We are all exhausted. We're all grouchy. We're all tired of being told what to do. And we've seen a little bit of that on campus, but in general, we all know if we're going to be here and we're going to stay part of this family, that this is what we have to do. And we've seen that demonstrated very well by our student body.
So at the end of the semester, what is it that you're telling students, faculty, and staff about going away for the holidays?
So again, we're following here the CDC guidelines that say, as much as you want to go home and see everybody and go to parties and celebrate, that's actually going to keep us from being able to come back to a place where we can have fellowship and we can have family time. So for me, the science is really important. And I know it's complicated and it's confusing, but it's really important for me that people have the science to make good decisions and to be able to base their decisions on science and not just, what they're hearing. So for me, really selling this to all the groups that I talk to and all the groups that I work with has been a big challenge because it's very difficult to explain what I learned in a 4-year PhD program, and condense it down to get people to understand it in 5 minutes. And so it's really been that struggle between making sure that on a personal level, the campus-wide, the pandemic response team, that was their commitment, was we're going to base this on science. It's just when I go and I talk to our smaller groups of employees, one-on-one, it's just really getting everybody to say, okay, I understand that. And, I'm going to go forth with that versus I heard it on Facebook or I saw this or I saw that. So I would say that's been a big challenge, is just trying to get the science to support decisions.
Okay. One last question. Moving forward, what are some of the protocols for students upon their return after holidays, or have decisions been made about what will happen when students are scheduled to come back in January?
So if we have learned anything from this pandemic, it's that if we don't plan well out, that we're going to get ourselves in a bad situation. So yes, the spring semester is planned. Students will be tested. The residential students will all be tested before they're allowed to move back in to their residence halls. They must come on campus and have a negative test. So we have rapid testing for that. And we're also going to test, it's also going to be required for any students who are coming on campus to take in-person classes, even if they are not residential. So that's going to be a big change because we did not test everybody who came back in the fall. But this, with this huge surge we're seeing, it's really concerning. So we've committed to that. In general, though, after that, it's really going to look a lot like the fall semester did. We know it worked for us. We know what worked, and we're just going to stick with it. We're still going to have about 60% of our classes are going to be fully online. I think about 13% are going to be hybrid. And then we are going to have, excuse my math here because I'm just estimating, but I think, we're looking at a little higher percentage of strictly in-person classes than we had last fall, but really it's well under our 15% mark. So it's going to look very similar. And, we all hoped differently. We all hoped we could come back in the spring in a very different way. And it just hasn't worked out. So we're going to keep doing what we've been doing that we know works, and hopefully have another very successful semester.
Okay, thank you so much for your time today, Dr. Long-Witter. I appreciate your taking time. I know that you're extremely busy.
Oh, you're very welcome. And like I said, we like to get our story out there because we are very proud of our success this semester.
Okay,
So
and
thank you.
yes, thank you so much. And thank you, audience, for listening, and thank you for watching on Facebook. We appreciate your time and attention. And I'm Kimberly Pierce Cartwright. Until next time, we'll see you on COVID Conversations. Thank you.